Okay, well, good morning, everyone. I am so honored to be here in Newark to highlight the fiscal year 2023 budget items that will allow Nurture New Jersey to continue its work transforming New Jersey into the safest and most equitable state in the nation to deliver and raise a baby. I want to thank my husband, the legislators, all who have advocated for the inclusion of these items in the fiscal year 2023 budget, some of whom are either here already or on their way here today. And that would include the Majority Leader, Teresa Ruiz, the Budget Chairwoman, Teresa, thank you. And I see, actually they're all here, okay. Budget Chairwoman Eliana Pinto-Marin, and Assemblywoman Cleopatra Tucker. I honestly cannot overemphasize the dedication and the work that these legislators have put into advancing all in this sphere. Truly, without their dedication, we would not be where we are today, and I am grateful to each of you three, so thank you so much for being here. I am joined today by an incredible panel who will share with us how these investments will support the health and well-being of mothers, babies, and families all across our state. We have so much to discuss, and I want to give our panelists as much time as possible. But first, allow me to share a brief overview of the maternal and infant health related funding in the budget. $20 million will go towards supporting the development of our Maternal and Infant Health Innovation Center in Trenton. Over $17 million will help us continue developing our universal newborn nurse home visitation program. $15 million will go toward raising Medicaid rates for maternity care providers such as OBGYNs, midwives, and doulas. $1 million will be allocated through facilities grants to increase opportunities for midwifery education and training. Over $2 million will go to increasing case management capacity in our Connecting NJ hubs to connect more New Jersey families with the services that they need. $2 million will allow us to create a Nurture NJ maternal health public awareness campaign to increase understanding of the crisis and the support available. $600,000 will go toward a database of maternal feedback on quality of care, formalizing a process to include the voices of mothers in policy development. Wardrobe malfunction. No problem. $500,000 will go toward expanding the reach of the Colette Lamothe-Gillette Community Health Worker Institute. And $100,000 will go toward developing a stillbirth prevention public health campaign. All told, these critical investments total nearly $60 million. And as every family knows, a budget is a reflection of one's priorities and values. Together, Phil and I have raised 4 children. No doubt the most important thing we will ever do. From day one of our journey together as parents, I have benefited from Phil's constant support and respect, and I could not be more grateful and proud to see the same respect and support reflected in this budget. To put it simply, we fund what we value. This administration values mothers. This administration values babies. And this administration values families. The work of Nurture NJ, our statewide maternal and infant health initiative, and is broad in its scope, so broad that I would like to take this opportunity to review the ground Nurture NJ has covered so far. Over the past 4+ years, our community-wide family festivals have brought state, county, and local resources directly to more than 5,500 families. In that time, Governor Murphy has signed 43 pieces of maternal and infant health related legislation. These groundbreaking policies include establishing the first and most robust in the nation newborn nurse home visiting program, Medicaid coverage for doula care. We were third in the nation to achieve that. And first to fund community doulas, as well as being second in the nation to expand Medicaid coverage for a full 365 days postpartum. These policies are groundbreaking in that we were among the very first nationally to make these important changes. But they're also incredibly common sense. As any mother will tell you, what she needs most is support. In January 2021, after a year of speaking with hundreds of partners across the state, most importantly, including our mothers, we released the Nurture NJ Maternal and Infant Strategic Plan, our blueprint to reduce maternal mortality by 50% over 5 years and to completely eliminate racial disparities in birth outcomes. Now, with the fiscal year 2023 budget funding, we are following our blueprint and taking incredible steps beyond what we have already achieved in our effort to become the national leader and gold standard for maternal and infant health care. And now it's my honor to welcome our panelists and begin our Q&A. Let's begin with our incredible Commissioner of the Department of Health, a woman who needs no introduction, Judith Persicelli. Judy, thank you so much for joining us. The fiscal year 2023 budget includes critical items that further the work of Nurture NJ, such as funding for stillbirth prevention awareness campaign, midwifery education training, a database of maternal feedback, and funding to expand the reach of the Colette Lamothe Gillette Community Health Worker Institute. How will this funding build upon the Department of Health and Nurture NJ's existing maternal and infant health efforts and further our collective mission?
Thank you so much, First Lady Tammy Murphy, for convening this important discussion today. I had to dip over because the binky was lost, so that was more important. We had to make sure that that was saved. The goals of this visionary plan are all within reach and aim to improve maternal outcomes, eliminate racial disparities in birth outcomes, and make New Jersey the safest, most equitable place in the nation to raise a baby. An integral part of the plan within the department is the work of the New Jersey Maternal Care Quality Collaborative and its focus on maternal mortality rates and new challenges the department faces in addressing maternal health disparities. Since its launch, the collaborative has challenged all of us to begin reimagining what a safe and healthy New Jersey for all birthing individuals actually requires. The programs and resources leveraged through the collaborative support, the infrastructures that are needed to hold the vital gaps in maternal mortality and morbidity, to hold them and to make them go away. Programs like the doula pilot program, the home visiting program, the postpartum depression screening tool, and the Community Health Worker Institute benefit the provider level, boots on the ground work supported through Nurture New Jersey. As part of Nurture New Jersey initiative, our current budget includes $1 million in additional funding to increase access to midwife care by ensuring opportunities for the education of midwives. In addition, the governor's budget increased funding an additional $500,000 to expand the number of community health workers who will be trained through the Colette Lamothe Gillette Community Health Worker Institute, a virtual institute named for our colleague who sadly passed away from COVID. The institute was established as an apprenticeship training program to bring community health workers to vulnerable populations to meet their maternal and child health needs. New Jersey has been a pioneer in the Maternal Mortality Review Committee process, which identifies, reviews, and analyzes maternal deaths and disseminates findings and acts on results. The committee, as you may know, is one of the first in the United States and has been continually meeting since 1932. And it's best positioned to comprehensively assess maternal deaths, and identify opportunities for prevention. Last year, the First Lady and the Health Department released the third report card of hospital maternity care that included interactive data on hospital-specific and statewide surgical births, complication rates, and severe maternal birth complications. The report card, which captured data, the latest available data in 2019, the 2020 report is soon to come out, illustrates improved cesarean delivery rates, which dropped from 34.4% to 33.3%. Those rates have steadily improved since the first report card, which showed cesarean delivery rates at 35.7%. While sometimes medically necessary, cesarean deliveries are associated with elevated risks of hemorrhage, infection, complications from anesthesia, future pregnancy complications, and infant respiratory problems. Disparities persist here as well among New Jersey's Black and Hispanic mothers. The rate for these complications were more than double for non-Hispanic Black mothers than non-Hispanic white mothers, and 4 times the rate for Black women. While the national target for surgical cesarean birth rates by hospital among women considered at low risk was 24.7 per 100 live births, in New Jersey in 2019, we were at 26.7. We have work to do. However, 16 of the 49 New Jersey birthing hospitals met that benchmark, which is an improvement over the prior report when only 10 of these hospitals met that benchmark. So improvements are being made. The current budget also includes $600,000 to create a mechanism to supplement our CDC survey grant and obtain additional maternal feedback on birthing experiences. The survey will be designed to welcome and respect feedback on how care throughout pregnancy, birth, and postpartum is experienced, and will shed light on opportunities to improve access, care, and very important, communication. The department is also working to develop a stillbirth prevention public awareness campaign. It's our goal for the campaign to highlight resources and education to help improve healthy pregnancies and birthing outcomes, and to ensure that fewer parents experience the pain and loss of an unborn child. Across New Jersey's healthcare system, there is a shared commitment to reducing maternal mortality, morbidity, and disparities. Protecting our mothers will result in healthier families and a stronger and healthier New Jersey. We still have much work to do to meet our goal of making this state the safest state in the nation to have your baby. We are all part of the solution, and to ensure that all mothers are given an equal opportunity to thrive and live a healthy life with their children, and that we create a state where every child achieves optimal health. Thank you.
Thank you so much, Judy. I know I speak for everyone, but thank you for your partnership and your leadership at the Department of Health. I can't wait to see all of these initiatives grow over time, so thank you for sharing all of them with us. Next, we have our outstanding commissioner of the Department of Human Services, Sarah Adelman. Sarah, thank you for joining us today, and congratulations on your recent swearing in. Really thrilled you're our commissioner. Okay, so Sarah, the fiscal year 2023 budget includes $15 million to raise Medicaid reimbursement rates for maternity care providers, including physicians, midwives, and doulas. How will this funding build upon all that the Department of Human Services and Nurture NJ's existing maternal and infant health efforts have done, and specifically, how will this increase help to improve maternity care services?
Thank you so much, First Lady Murphy, and good morning, everyone. Special thanks to Clinton Hill Early Head Start and Child Care Center for hosting us this morning, and for the leaders and teachers who are here. Thank you for taking care of our kids. Thank you, First Lady, for that question. 1 in 3 births in New Jersey is paid for by New Jersey Family Care, our state's Medicaid program. So when Commissioner Persicelli talked about the outcomes that we're seeing in our data, particularly the poorer outcomes for women of color across New Jersey, as the entity that is reimbursing for 1 in 3 births in New Jersey, that means that 1, we have an enormous responsibility to take steps to address this challenge, but 2, that we have an incredible opportunity to make investments and to turn the tide on these challenges. So, as we have looked over the last 5 years at our budgets, and the First Lady talked about how budgets are a statement of our values and priorities, I am so grateful to Governor Murphy and First Lady Murphy for making sure that every consecutive budget we have been investing in new strategies to help address these challenges in our Medicaid program. So over the last 5 years, we have, number one, as the First Lady said, become the second state in the nation to provide 1 full year of health insurance coverage to a mom after delivery who otherwise might have lost income eligibility for our Medicaid program. So number one, in order to keep our moms healthier and to have the best possible outcomes, we want to make sure they remain enrolled in their health insurance coverage. So that was a huge step for us to take, and very proud to be the second state in the nation to be able to do that. We also, and Commissioner Persicelli just talked about how the data is already bearing out results from all of our work across government in ending early elective C-sections. When you have an early elective C-section, that's usually a physician has scheduled a C-section out of convenience, but not because it's medically appropriate. The outcomes are poorer. And so one of the things we needed to do was change our payment policy to not incentivize or allow for those early C-sections to be delivered. So we in Medicaid have stopped reimbursing for early elective C-sections, and we're seeing a shift and a change in the data already. And we were able to use the savings from that policy change to invest in things that make more sense, like increasing reimbursement for midwives. We've now changed our Medicaid reimbursement policy to pay midwives 90% of what we pay a physician. This has helped attract more midwives to participate in the New Jersey Family Care Program, to be in Medicaid's network, and to serve Medicaid moms and babies across the state. We've also used those funds to create a doula program in Medicaid. We were the third state in the nation to roll out doula benefits. We're now enrolling doulas to be Medicaid providers in our networks, community doulas to provide services to moms and babies throughout the birthing process. And we have rolled out a new model of payment. It's called an episode of care. And what this really means is that we pulled together physicians, hospitals, healthcare leaders, doulas, people with lived experience, and created a new payment methodology in Medicaid that physicians and OBGYNs can participate in voluntarily, where we are going to pay them more for better quality and better outcomes. So the higher the quality and the better the outcomes, the more their reimbursement increases. And conversely, if we see poorer outcomes or lower quality, their reimbursement will be lessened. Throughout this process, we're providing additional support and data to these physicians and OBGYNs and midwives who are participating to help support them through this episode of care, from prenatal services, labor and delivery, through postpartum. So we were very excited to take all of these steps. But First Lady, you asked me about the $15 million in the budget. The one thing that was a really big step that we hadn't yet taken was to look at our reimbursement rates across the Medicaid system for prenatal services, for labor and delivery, and for postpartum services, and answer the question, do individuals in Medicaid get different care because our reimbursement rates are lower than in the private sector, in a private payer? And what we were able to do in the budget this year, thanks to the support of the Governor and the First Lady and our phenomenal legislators who are here with us today, was to invest $15 million of state money and get $15 million in federal match, for a total of $30 million to across the board increase our reimbursement rates in Medicaid from prenatal services through labor and delivery and postpartum services to 100% of the federal Medicare rate. So that is in some cases, that was a 60% increase to our reimbursement rates. That is a huge step that we've been able to take so that when we think about does Medicaid payment impact the quality of service that people are getting, we're eliminating that question. And we're taking it off the table so that payment is no longer in our minds as a factor that would impact care for moms and babies in Medicaid. So thank you, First Lady, for your question and for having this discussion today. We have now, through these steps we've been able to take in Medicaid, really become the state to watch across the nation. And even next week, I will be at a national conference with all the Health and Human Services secretaries where I was asked to talk about the work that we're doing here in New Jersey because we really are leading the way. And it is through your strategic plan and your Nurture New Jersey initiative. So thank you very much.
Can't thank you enough. I am so excited just listening to you and to Judy as we advance all that we've been working on. And certainly if we are able to improve access to quality care and providers, then certainly we are going to improve outcomes for our moms and our babies. So thank you. Thank you. Okay, so next in the hot seat is Tim Sullivan, the Chief Executive Officer of the Economic Development Authority. Welcome, Tim. Tim, the Maternal and Infant Health Innovation Center that is intended to carry out the work of Nurture NJ beyond this administration and to ensure that New Jersey continues to make progress in becoming the safest and most equitable state in the nation to deliver and raise a baby is very exciting. Do you think you could possibly share the community engagement work done to date and how the additional funding in this budget is going to bring the Innovation Center closer to fruition?
Sure. Good morning. It's an honor to be here with everyone, and particularly you, First Lady, for your leader. I want to give you a shout out for your leadership and bringing this all together. I remember when this work started, 3 or 4 years ago, bringing together all these agencies and stakeholders together. The progress already, and you hear what the things Judy and Sarah were describing, and the complexity and the importance of those things. It's just extraordinary, and I'm in awe of the incredible work that the administration has done on this incredibly important issue. I do economic development for a living. I don't often talk about things that are actual life and death, and this is. And so this honored and privileged to be a small part of this work. The Maternal and Infant Health Research and Innovation Center in Trenton is going to be an extraordinary asset for the city of Trenton, for the state of New Jersey, and ideally a national model for attacking this challenge and these unacceptable disparities in maternal and infant health outcomes, particularly for moms and babies of color. The basic idea here is, can we bring together all that New Jersey has to offer, and who better to attack this challenge and this problem than New Jersey, between our institutions of higher education, our extraordinary healthcare delivery providers, the extraordinary policy leadership from the Governor and First Lady in partnership with the legislature, institutions of higher education, and our pharmaceutical and life sciences industry, which is second to none in the world. Who better to bring together all of those pieces of the puzzle I'm mindful of the little puzzle on the floor here, so the puzzle metaphor came from the floor here, to bring together all those things to attack this challenge comprehensively. And so with this budget, with this $20 million of funding in the budget, as well as some hope for federal funding that the governor has allocated, and hopefully the feds will approve sometime this fall, we can say with confidence and certainty the center is going to get built. And it's going to be built in Trenton. Again, it'll be an extraordinary resource for the city of Trenton, and a city that needs a significant improvement in the quality of care delivered to moms and babies in our capital city, but also be a model, a resource for the entire state to deliver the benefits of this research and innovation activity across the state. But that only happens, and it only is done right if we get it right on the community engagement side of the equation. So our board approved using some of the funding we had in last year's budget earlier this spring to hire the Watson Institute at Kean University, and they're partnering with Stockton University as well to be doing really comprehensive community engagement. They're on the ground right now. They've been doing that most of the summer. They'll be engaging in that work, and when we say community engagement, talking to moms and babies, probably not talking to the babies, they don't have a ton of feedback, but the moms of recent vintage, as well as folks who might become moms, talking to faith and community organizations, talking to healthcare providers in the community now to make sure we understand yeah, it's great to think about something that 5, 10, 15 years will have an impact on the sort of the R&D and innovation side, but also moms and babies need help today. And so how do we incorporate those needs in Trenton today to bring together, again, higher education, clinical care, and be a shot in the arm for our capital city that could surely use a few shots in the arm as well. So we're incredibly excited about this. Again, it's really deeply important work to support. I think the First Lady put it great. We support moms, we support babies, we support families. I think who could argue with that? And so we hope will be an extraordinary resource and asset, and we're doing it in great collaboration, not just with the city and the county, but with our partners throughout the government, Judy and Sarah, and the treasurer, the lieutenant governor, Secretary of Higher Education, Commissioner of Labor, because there's a workforce dimension of this. There's how do we train the next generation of great, we're going to hear some examples of the kind of workforce improvement growth that we have in front of us. And so we think this has the opportunity to be a game changer. And importantly, as the First Lady said, to carry this work on for generations to come. I don't think anyone's under the illusion this is going to get solved this week, this month, this year. This is going to be a generational challenge to undo generations of disparate and systematically unfair, discriminatory treatment of moms of color in particular. And so carrying this work on in posterity is deeply important in this institution. We hope we'll be the carrier of this flame, for decades to come.
Thank you, Tim. I would just add, it's really important that this center is going to be located in Trenton for a myriad reasons, but not the least of which the legislators who are here today have worked really hard, and I hope that this center will be a resource for others across the country who might wonder what steps can we make, and they will benefit from the great work that's been done in Trenton. So I would just add that. And Tim, we couldn't do it without the EDA, so let there be no doubt we are grateful for your critical work. Okay, our next question is for Raquel Reyes, a midwife who recently graduated from Rutgers and was hired by Newark, Beth Israel. Raquel, thank you for being here today, and congratulations on your new job.
Thank you. It's a pleasure. Thank you, First Lady Murphy, for having me here. It's definitely an honor. The fact that we're getting $1 million, the investment in midwifery education would mean a lot of things for us. One, greater diversity of clinical sites and clinical experiences, more sites and more varied sites. It would mean preceptors with more dedicated time for support and guidance for students, more personal attention for students, definitely. The preceptors that are integrated fully into the academic programs will allow for greater alignment of what happens at the university and what happens at the clinical sites. The expansion of the midwifery program at Rutgers. The historic lack of clinical sites has limited enrollment. Greater enrollment would lead to expansion of the profession in New Jersey, definitely. So the big picture definitely would be the funding will lead for a more welcoming environment for midwives in the hospitals. The established presence of midwifery students incentivizes hospitals to have more midwives on staff, which would ultimately change the culture of birth across the state and improve definitely the birth outcomes that we definitely need in this state. As the commissioner has said, the C-section rates are increasingly too high in the state of New Jersey. We need to bring those numbers down and improve these outcomes in New Jersey, especially for our moms. But again, thank you for this opportunity, and thank you for having me here today.
Thank you, Raquel. It is always helpful to hear from real life experience, and I would just say that the $1 million I think is definitely it represents the values that we all feel so important, and midwifery care is vital. So thank you so much, and good luck with your new job. Okay, our next two panelists, Vuann Foster, founder of Life After Two Losses, and Kashika Phillips, a community health worker at New Destiny Family Success Center, are not only incredibly dedicated advocates for New Jersey's mothers and babies, but they are also mothers themselves. In fact, I happen to know that Vuan's lovely King Cairo is currently hanging out with one Stephanie Lagos over there. So thank you, Stephanie, for stepping in as a new mom yourself. It is a core value of Nurture NJ to include the voices of mothers in everything we do. And so we are really incredibly grateful to all the mothers who have made the time to share their perspectives and experiences with us. Welcome, Vuan and Kashika, and thank you both for being here today. Vuan, I am proud that this budget includes funding for a stillbirth prevention awareness campaign. How will a campaign like this help expectant moms in New Jersey?
So thank you so much for having me, First Lady. It is an honor to be here to talk about this. So first, before I get into that, I suffered 2 preventable pregnancy losses, and I founded my nonprofit Life After 2 Losses, which we support, empower women and families who suffer pregnancy loss, and we also empower women, families, and communities with effective ways to deal with preventing pregnancy loss. So this is important because a lot of the women we counsel are not aware that there are ways to prevent stillbirth, and one of those ways is counting kicks. They were not aware that there are things that they can do to prevent pregnancy loss. And I myself was not made aware about things to prevent pregnancy loss until I was already done with my second pregnancy. And that's a problem.
Thank you, Vuan. The stories that mothers have shared about their personal experiences have literally been the driving force behind Nurture NJ. So I thank you for your advocacy and for your repeatedly showing up and helping us to explain the importance of everything we're doing.
Thank you.
Yeah. Okay, Kashika, as a community health worker and as a passionate advocate and a mother, can you help explain why the Nurture NJ items that we have highlighted today are important to you?
It is important to me because it is needed. As you know, I am a community health worker, and I'm very hands-on with the mothers in my communities, specifically Paterson, New Jersey. And I can't tell you the amount of endless stories that I hear as far as them needing assistance with their prenatal care, their postpartum care. And I mean, I'm there to help, I'm there to advocate, but yet there needs to be more resources, which is what I truly believe that this budget is doing. Like, for example, I have several clients today that I'm working with, or mothers that I'm working with, and they're really concerned about who's going to be their support person when they're in labor and delivery. And I always explain to them, you know, have you ever heard of a doula? And you would be extremely surprised about the amount of people, especially expecting mothers, that are not familiar with what a doula is. So with the help of Nurture NJ, we'll be able to spread that awareness and, you know, really get the moms the help that they need. Thank you. Oh, and first, I just wanted to thank you for First Lady for having me here. This is a great opportunity and definitely an honor.
So thank you, Kashika. It's our honor to have you here, I might add, and it's always really helpful to hear the perspective of a New Jersey mother. I am incredibly hopeful that each of these programs will not help us to just improve our maternal and infant health outcomes, but literally to make us the gold standard. So thank you. On that subject, I think I have one more question for the two of you, Kashika and Vuan. The budget also includes funding for creating a database of maternal feedback, which will allow us to gather the critical perspectives of new mothers across the state to help inform, you know, policymakers, providers, hospital systems, and other shareholders to better ensure real impactful change. I wonder if you, as moms and advocates for other moms, can help us understand how centering women's voices ensures strong, effective, and sustainable policies. Kashika, Vuan?
You want to go first? Okay, so I think it's important to center women's voices because, one, especially surrounding pregnancy loss, there's a lot of trauma that is happening in the birthing space, and by capturing that, we better know how to prevent that, and that's one aspect of it. I also feel that there were physicians and nurses who got it right. And I think it's important to capture those moments as well, because maybe they can be the ones that train other professionals who are not, acting in a manner that they should be in the birthing space. So I think it's important to, right, because having a baby should be a beautiful thing. And even if it does end in loss, sadly, you should still be treated with dignity and respect. And it's enough to be traumatized by having a pregnancy loss, but then to be traumatized by staff and providers, it's unacceptable.
And I completely agree with everything that Luann just said. But I also wanted to add that it is very important for moms' voices to be heard. As I mentioned before, as a community health worker, they come, they express, but it pretty much just hits like a wall, right? Because we don't really have a location to really share their thoughts in order to make the changes that we want to see. And I truly believe that with this database, we'll be able to track, we'll be able to observe, and the best part, we'll be able to see the benefits of Nurture NJ. So thank you.
Thank you both for sharing that with us. Not about us, without us has been a phrase that we have heard repeatedly across the state, and ensuring that there is a mechanism to actually receive the feedback and being able to make changes that are informed by that feedback will really be a game changer for us. So we are really excited about that. So thank you. Okay, with that, I would like to thank all of our panelists for being here today and for your tireless work in this field and on behalf of New Jersey's mothers and babies. Again, I want to thank our legislators. I am personally so humbled and honored that you joined us today, and thank you for helping to highlight the importance of all the work that you have been doing and all the work that everybody here feels so passionately about. So thank you all for being here. So, I have found that as broad as the scope of Nurture NJ is, and it's broad, as you can see, it is also incredibly personal. As I said at the beginning of our program, the budget is truly a reflection of our values. Our maternal and infant health crisis is just that. It's a crisis. And we have a moral imperative to solve it. I am really proud of the painstaking work that we have undertaken thus far to really delve into the underlying causes and to understand the full scope of what it will take to become the safest and most equitable state in the nation to deliver and raise a baby. Together, we obviously continue to make progress, and with this funding, our plans are becoming realized. Like spokes on a wheel, our work continues in many directions, but every step we take brings us that much closer to one thing: healthier mothers and babies. So I thank you for your attention today and for your partnership in the important work of Nurture NJ. I don't know if there are any follow-up questions from the press, but we are happy to answer them if there are. No? Okay. Pardon me? Okay. All right. I think we are going to call it a wrap. So thank you all so much for coming out today. Really appreciate it and look forward to working with all of you as we move forward. Thanks so much.